Thriving. We're going to begin now. Good afternoon, and thank you for joining us at our first of 3 Lunch and Learn sessions of Put Your Oxygen Mask On First, Thriving Through the Postpartum Period, presented by the Newton-Wellesley Hospital Maternity Services Council. Today's session will focus on the physical changes that come with the birth of a baby. My name is Dr. Veronica Bloom, who is a mom of 4 children in their 20s, and I'm thrilled to be able to moderate our 3-part lecture series during May as a way to celebrate Mother's Day and honor our moms. Please note that we will be recording the keynote speaker's presentation, but we will stop the recording during the Q&A so our panelists and audience members are comfortable asking and answering sensitive questions. Please feel free, and we encourage you to type in any questions you may have in the Q&A feature anytime during the presentations. Following the 3 sessions, all registrants will receive an email with a copy of the recording, as well as relevant community resources. It is now my pleasure to introduce today's presenters. Dr. Lisa John Albanese is a maternal fetal medicine physician at Newton-Wellesley Hospital. She's board certified in internal medicine and OBGYN. She studied at Ohio State and completed her internship and residency at Brigham and Women's Hospital. She currently serves as the chair for the Maternity Services Council and has 2 children, Luke, who is 21, and Isabella, who is 17. Our special moms today who are giving us our time. The first is Andrea Carrillo Rhodes, mom of a precocious bilingual 2.5-year-old toddler, Damien, who came early via C-section at 37 weeks. Andrea lives in Belmont with her husband, Kevin. She's an attorney in legal services, works a hybrid schedule that includes commuting into downtown Boston and practicing in courts around the Boston area. She serves on professional committees and likes to support new moms and young women who ventured into the legal field. To recharge, she enjoys spinning, rock climbing, running, and sculpting. She started our WhatsApp group for the Newton-Wellesley support group that took off in 2020 at the height of the pandemic, and continues to provide moms with a virtual support text group. She credits midwife Angela Rostami for helping her recover postpartum through the Newton-Wellesley support group. Our other mom today is Maggie Barrett, and her husband Adam are parents to 11-month-old Julia, and they live in Cambridge. As a self-employed architect, Maggie found maternity leave difficult to plan for and one of the bigger stresses ahead of the birth. When Julia was just 2 months old, the family packed up and moved across town, another enormous hurdle for them. Practical and emotional support from the Newton-Wellesley Zoom and WhatsApp group were essential for feeling grounded through such major transitions. Both parents work from home, and little Julia has a hybrid daycare schedule, 2 days a week with her grandparents and 3 at a small daycare. I will now turn it over to Dr. John Albanese for the feature presentation. Thank you.
Let's see. Hi, everybody. I'm going to start sharing my screen. Oops, Kim, I'm disabled from sharing. If you can enable me to pull up my slides.
All set.
Oh, thank you. There we go. And by this, there we go, slideshow. So I will try to keep it to my 15 minutes. As mentioned above, I'm a mom and a doctor, and I definitely had some surprises postpartum that I wasn't prepared for. So we'll talk about all that. So thriving postpartum. And today there's so much to go on. We're going to be doing emotional and social changes and other talks. So I'll try to keep just to the physical stuff. But basically, I remember thinking, what just happened? So we already talked. I graduated from Ohio State, did my residency here. And I have 2 kids. Luke was born at Ohio State and Isabella was born here at Brigham and Women's. And I've been seeing patients at Newton-Wellesley since about 2004 and took over as the medical director of MFM here in 2013. So today we're going to just review very briefly some physiologic changes that actually occurred during pregnancy, because they will relate to postpartum, what's normal physical changes after the baby comes, things that happen postpartum when you should be calling the doctor. And really, I think the other thing too is just an evolution of thinking. My training in the 90s is very different than the way that we think about the fourth trimester now. I think just, recognizing in general the increasing maternal morbidity and mortality in this country for many different reasons, but a lot of it happens after the delivery. And so I think we're starting to shift the framework to just better care of moms postpartum. So it's about time. And I'm going to share what I did not learn in medical school or residency as it pertained to my own postpartum experience. After the talk, we'll introduce our two community moms, with Veronica already did, and we'll have Q&A as well. And I just have to put it out there, no matter how your baby came out or when it came out or any of the circumstances, your body did something that is absolutely amazing. And it always matters. It takes a lot of time to recover from it. So I always hate when people are a little too hard on themselves. I think, even though it's natural, it's a big deal. And anyway, I think it's pretty amazing. So so diving in just for a couple of slides, just normal physiology of pregnancy. What happens to the cardiovascular system is pretty impressive. And what happens is that, and some people notice that their heart seems to beat a little bit faster in pregnancy, and it does. The resting heart rate increases, usually not higher than like 1 teens, but the resting heart rate, even when you're sitting there, is higher. It's a big stress on the cardiovascular system in general. Your plasma volume, so the circulating fluid in your body, increases anywhere from 30 to 50%. Cardiac output increases 30 to 50%. The small little capillaries in our peripheral vascular system, so like our extremities, that decreases in pregnancy. And so that's why some people feel a little bit faint in the second trimester, because the blood pressure actually does drop between 12 and 19 weeks. Gradually it increases back to baseline, whatever that is. Some patients have chronic hypertension, but sometimes it overshoots as you get closer to 40 weeks, and you can actually have hypertension at the end. And then after the baby comes, there's a lot of hemodynamic stress to the body during labor, and then right away right after the baby comes out, because you get this transfusion of blood that comes from the uterus actually. And, plus the blood loss related to delivery. So this is a busy slide. I'm not going to focus too much on it, but the respiratory changes, just because I get a lot of questions about it. So ventilation is the exchange of oxygen and carbon dioxide in our lungs. And there's a formula for it, and it's your respiratory rate. So how fast you're breathing multiplied times tidal volume, which is the amount of air that you just move in and out of your lungs on a typical breath. And your tidal volume changes in pregnancy. You end up taking bigger, deeper breaths, which translates into feeling short of breath, because you're not exercising, you're at rest, and that there's progesterone from your pregnancy driving you just to take bigger breaths. So you feel like you're short of breath and you're breathing faster, but you don't. The respiratory doesn't change, but that tidal volume changes. And the idea is to breathe off more carbon dioxide so that the baby can get rid of his or her carbon dioxide through the placenta. But it does make you feel short of breath. So from a hematologic perspective, so a lot of people, and we check for it in the third trimester, a lot of people get anemic during pregnancy. But what's actually happening is that there's still an increase in the amount of red blood cells that you have, by quite a bit, which, assuming you have normal iron levels and iron stores, your body can't do what it needs to do without adequate iron stores even to start. But your plasma volume increases more than the red cell mass. And so you get this physiologic anemia of pregnancy. And some of it is just to prepare us for blood loss that comes with delivery. The other important thing that happens in our hematologic system is that our coagulation factors, so there's some factors in our blood that keep us from bleeding to death, when we cut ourselves or something like that. But there's also factors that keep us from having blood clotting inside of our body, so that it can flow through our veins. So that balance shifts more toward a procoagulant state, and it's really to prevent excessive hemorrhage at delivery, but it's also a risk factor for getting a blood clot during pregnancy, which we'll talk about in a bit. And believe it or not, so the hematocrit does fall. That's your basic blood count after delivery, but it starts to get back to baseline around 3 weeks. But those coagulation factors, it takes 6 to 8 weeks for those blood clotting factors to actually shift back to normal. So why are these important? I would say sometimes it's just tough to know what is a normal symptom of pregnancy and when you should really seek medical attention. So that's why I reviewed some of the cardiovascular stuff. And I will also say this, there are patients who do have underlying cardiac issues that do not tolerate pregnancy well at all. And nobody ever seems to anticipate that because the uterus is down here and my heart's up here, but it all really matters. But the other thing to remember is that patients with pregnancy related blood clots, so like either a deep venous thrombosis or a blood clot to the lung, that's called a pulmonary embolism. So a lot of patients present during pregnancy, but because it takes so long for those blood clotting parameters to get back to normal, I would say most patients end up actually presenting postpartum. So, just being aware that physically that you can get a pregnancy related blood clot, even though you delivered the baby 3 weeks ago. This is just basic postpartum physiology. So what's happening to your body in like those first couple of weeks after delivery. Uterine involution is just the uterus contracting back down to normal, which is a process over time. Initially, when the placenta comes out, you have these huge blood vessels that were supplying the placenta. And they're just open. And if the uterus doesn't contract down normally, that's how those vessels are tamponaded to keep from bleeding, is that they're just squeezed by the uterus contracting. So that's really important, in those first hours after delivery. And even though the baby's out, you're left with this uterus that's still like, it looks like you're still 20 weeks pregnant, because that's just how big the uterus still is. But by 6 to 8 weeks, though, it gradually starts to get smaller, but especially in those first couple of weeks, you can get really intense contractions that just take your breath away. And that, and then when you're nursing, the uterus, the oxytocin that makes, so the baby is on the breast and oxytocin stimulates the milk to let down, but it also contracts the uterus all at the same time. And so I remember noticing when I was breastfeeding, like they would just kind of all happen at once. But that's normal. That's just your uterus getting back down to normal. And then lochia, that is the name for the normal shedding of the lining of the uterus, the decidua, and there's different layers to it. And it changes, the characteristics of it change over time. For the first few days, it's kind of red or maybe like a reddish brown. Then it gets a little bit more like pinkish brown, a little bit more watery for a couple of weeks. Kind of a yellowish white later, but sometimes it just intermittently persists for 6 to 8 weeks. And so pretty much I remember being caught up thinking, okay, it's done. And then suddenly it wasn't done and wish, I had a pad. But it's normal to intermittently have bleeding that comes. It's just normal lochia. I'm not going to talk a lot about lactation, because I think the lactation consultants are better, but just when to expect breast engorgements. Typically it's that first 1 to 3 days postpartum. Up to 7 days is within normal, which is frustrating because your baby is hungry. And sometimes it's accompanied by mild temperature elevation. You shouldn't have like a 101 fever, but you can have like a low grade temperature when milk comes in. And for patients who are not breastfeeding, I always recommend a really tight bra and just avoiding breast stimulation. Sometimes even ice packs help. Weight loss immediately after the delivery of the baby. So you've got the weight of the baby, but there's also placenta, there's amniotic fluid, there's all that vascular fluid that we kind of hold on to in our bodies. And so on average, just right after the baby comes out, it's usually about a 13-pound weight loss. And about half of it comes off of what you total gained during the pregnancy in those first 6 weeks. And then it's just sort of a gradual, hopefully, loss and back to normal pre-pregnancy weight. But a lot of it happens right after the baby comes. So the other things, and I have a couple of slides later, I may end up kind of talking about it now. So what else is normal? So the pelvic muscle. So when the baby comes out with a vaginal delivery, there's a lot of, some people have a tear and a laceration of the muscles around the perineum. But if you don't tear, there's still a lot of stretching that happens. And there's, sometimes the anal sphincter, that is the muscle. It's a round circular muscle that surrounds the anus and the lower part of the rectum. And sometimes that can be injured, even you can tear and injure that muscle, but sometimes people don't have any tears and that muscle can still be injured. And so it can really lead to issues with either incontinence of flatus or stool, or sometimes just feeling very weak. Some patients have urinary incontinence, which we'll get to a little bit, but really there's a whole lot of stretching and trauma really to that part of the body, which may not ever really quite get back to the pre-gravid state, but sometimes doing pelvic floor exercises starting at about 2 weeks might improve those symptoms by 12 weeks. Sometimes at 12 weeks, it may not be back to normal, but it gets better slowly over time. But the thing I want to drive home, and I'll probably say it again later, is that I think in the past, people with, the other thing is to say is just the pelvic floor is attached to our pelvic brim. And sometimes those attachments are also damaged during pregnancy. So things just kind of fall with gravity. And, the thing is, there's so many different treatments these days, some surgeries, but some of them are just non-invasive. And I would say this isn't just something that you have to live with. Like our mothers lived with it and didn't say anything, and our grandmothers, but like, there's too many things that we can do. You can talk to your OBGYN. This is not something, it can always be improved. And it's not something that you just have to live with. So return of menstruation is really variable, depends on breastfeeding, intensity of breastfeeding. But I bring this up because in patients who aren't breastfeeding, you can ovulate as early as 3.5 weeks after the baby comes. And so it is actually very important to talk about contraception with your OB, maybe before the baby comes or like before you go home from the hospital, just like have a plan for what you're going to do for contraception. In exclusively breastfeeding moms, about 40% will still not be having any periods at 6 months. That means 60% of people are having a period. They may not be ovulatory cycles. And for the most part, when you're exclusively breastfeeding, most people don't get pregnant, but you definitely can. So if you're not planning another baby right away, you need to talk about contraception. And this telogen effluvium, that is that hair loss that people get. So when you're pregnant, the phases of hair growth is dominant in what we call the anagen phase, which is the growing phase of hair, which is why we get this lovely, glorious hair during pregnancy. It gets all nice and thick, but eventually it's going to have to come out. And sometimes it comes out all at once. And so it seems like you're losing too much hair, but you're just losing the hair that would have been coming out anyway if you weren't pregnant. It just kind of comes all at once. And that's typically sometimes 1 to 5 months after delivery. So other postpartum physiology, sexual activity. Technically this survey, so definitely nothing, we usually say nothing in the vagina for 6 weeks. But the cervix itself is typically closed at 2 weeks. And the perineum may be healed. But what I would say is it's medically okay to have sex. I couldn't even imagine it. I mean, you're still bleeding and swollen and sore, and the lochi is coming, the vagina is dry, there's low sexual desire, you're exhausted. So more power to you if you feel like it at 2 weeks. You don't have to call the doctor like you're doing something bad if it actually happens. But I would say the vast majority of people are not ready at 2 weeks out. So I'm not advising it. But if it happens, don't worry, nothing bad will happen. But again, it's important to discuss contraception. There should be a 3-week follow-up. We'll get to that. So what are the things that I worry about, that I want to know about? Because these things can sometimes signal an actual medical problem that you need to see a physician for. So the first one would be headache. And, if you're tired and have a tension headache, or if you've had headaches before, a history of migraines, and you get one of your migraines, I'm not talking about like a typical headache. I'm talking about something that's more sudden onset, like the worst headache I've had. If you rest or take some Tylenol or pain medicine and it's not any better, like those are the kind of headaches that can cause a problem, especially if you're feeling very dizzy, stiff neck, obviously a seizure, I think someone would call their doctor for, but weakness, other focal neurologic signs, like those, that can be sign of, the most common thing, honestly, is usually hypertension and preeclampsia. And even if you didn't have hypertension during the pregnancy, you can get postpartum hypertension and preeclampsia, and it can be severe hypertension. Most people who aren't used to blood pressures that are severely elevated, and I'm talking like in the 160 over 110 range, you're not going to feel well. So you need to, if you feel horrible, you need to go with that and either check your blood pressure or just call the doctor's office and get seen. So hypertension and preeclampsia, but also stroke. We see strokes postpartum, or you can have a stroke because of hypertension. It could be stroke because of a blood clot, or even an intracranial hemorrhage. Sometimes people can have undiagnosed aneurysms, or tendencies to bleed, and those can rupture postpartum. I'm not trying to scare people, but just please seek medical attention for just an out of proportion, terrible headache. And again, I just said this hypertension can present for the first time after delivery. And if you present for care and we can get your blood pressure under control, it just lowers the risk for stroke. And again, in patients with severe hypertension, most strokes occur within 10 days of delivery. So the recommendation, so let's say you had hypertension let's say you got induced for some mild hypertension and then your blood pressures were fine postpartum. I recommend checking. You don't even have to come in physically, but at least check in with your doctor. You should go home with a blood pressure cuff if there's any issue with hypertension before delivery. I recommend people going home with a blood pressure cuff and just check in with your doctor. I recommend 3 days, at least within 5 days after discharge, because sometimes it just really spikes after the baby comes. And I think we don't educate women enough about postpartum hypertension. So that's leads me to some of the recommendations we have about postpartum follow-up. The other things I wanted to get to are acute shortness of breath or chest pain. We don't really see a lot of like myocardial infarction like older adults get, but coronary artery dissections we see, aortic dissections, pulmonary embolism, so blood clot to the lung, or even peripartum cardiomyopathy, especially patients who are advanced maternal age with hypertension. Sometimes the heart, it's almost like a congestive heart failure type picture, and people feel overwhelming fatigue and they feel really short of breath. You might have sudden increase in the edema in your extremities. So that's important to seek care. Very uncommonly, there can be really severe infections of the vulva, like the outside part of the perineum. So, I mean, of course, you're going to be swollen those first few days, but it should get better every day. And if you suddenly have an increase in swelling in the vulvar area, even without a fever, that can actually be a sign of a very serious infection. Or just increasing pain, like it was getting better and then the pain is getting worse. Let's say there was a laceration that was repaired. You can have a wound breakdown or even a wound infection. And I would say that I've had more than one person who came in with a wound breakdown saying, I just feel like I am sitting on a bag of rocks, more than just the usual soreness. Sometimes patients present with delayed postpartum hemorrhage, like 2 weeks out, you could be bleeding and like sometimes you just get that fresh show of blood and it's just normal lochia. But if you're filling up a pad in an hour and then the second hour is coming and you're still bleeding and filling up a pad in an hour, like you do need to come in. Sometimes there's little tiny pieces, like very small pieces of placenta, or membranes can be retained and your uterus just can't contract around it. So that paradigm shift to the fourth trimester in 2018, the American College of OB/GYN released new recommendations for optimizing postpartum care. And, just recognizing that those weeks following birth are a very critical period. You have all this
care.
And then you're just released to your pediatrician for several weeks. And it's a very critical time for the woman, for her infant, and then setting the stage for long-term health and well-being. And it should be an ongoing process and not just one 6-week visit. And so the new recommendation that for all women, even with a normal healthy delivery, have contact with their OB care provider within the first 3 weeks after the baby comes. And it doesn't have to be an in-person visit. It can be a telemedicine visit. But at least touching base, talking about contraception. We'll talk about the things to cover. And then just ongoing care is needed. And then the last visit can be up to, no later than 12 weeks after delivery. But I think about 40% of women come for their postpartum visits, at least nationally. Hopefully, I think it's better at Newton-Wellesley, but it is really important. What do you talk about? Your mental health, which is something that is going to be addressed, later in the seminar. How's it going with your baby's feeding? Contraception, we talked about that. Child spacing, and her pregnancy intervals under 6 months. It's hard. Your body's iron stores haven't recovered. You haven't gotten down to a healthy weight yet. Like it's important to wait at least 6 months. Best pregnancy outcomes appear to be somewhere around like that delivery to conception interval closer to 18 months. Even 12 months is fine, but less than 6 months, it's hard to get back on your feet. We need to address any abnormal bleeding or pain, concerns about wound healing, whether it's your vaginal laceration or C-section, dysuria or incontinence of urine or flatus or feces. We kind of touched on this before, like that we have interventions that can be non-invasive. Sometimes urinary retention, you can damage nerves to the pudendal nerve supplies the perineum, and sometimes you just cannot empty your bladder. Even to the point where some people even have to be catheterized for a while, but it does get better. It will get better. Sometimes people have pain, weakness, or just like numbness and tingling in their thighs. And it's because of, let's say you're pushing for 4 hours or just having your legs hyperflexed back, for such a long time. That can actually cause nerve damage, which will get better. And the biggest thing to take home, I would say, is that in patients who have medical complications of pregnancy, I think internists are starting to realize that they are huge risk factors for cardiometabolic disease later in life. So having a history of pregnancy, hypertension, gestational diabetes, or even a spontaneous preterm labor and delivery, they're all risk factors for coronary vascular disease 20 years down the line. And what can you do? Optimizing your health, exercise, healthy weight, control of blood pressure. These are things for the long term that you can discuss with your primary care doctor to optimize your health later. I'll go through this quickly. This is what I didn't learn in my medical training. Nursing may be very natural, but it's really hard. I think the only thing my baby knew was that he was hungry, and it wasn't that easy getting established with nursing. And I learned real fast that before I sat down to nurse a baby, change my pad, because when you let down, you get this fresh show of blood, and then it just feels really messy for the whole time you're nursing your baby. I made the mistake of not having my breast pad in on the other side that the baby wasn't feeding on. And now this was not invented. And the newer moms probably know about this, the Haka breast pump. There's like a little handheld pump that you can put on your other breast, and that's like 2 ounces of milk that I wasted when I was nursing, because that did not exist. And I always was crazy thirsty. Pitcher of ice water at my side. Oh gosh, the new normal relationship with my spouse, like it's so different. You have this new person who's, up every 3 hours. Eventually, when it was time to have sex again, I needed a nursing bra because I would let down during intercourse. The vaginal dryness was real. And I just it took months before I really felt like I just kind of had like my normal body back. And, I was 35 when I had my first. I was a professional woman. I'm like, I'm an OBGYN. I've been through this. I got this covered. And I'm used to working 36-hour shifts. I can handle, the sleeplessness. And I'm like, you know what? That sleep deprivation of my medical training wasn't anything close to sleep deprivation with a newborn, because as the new moms know, it is 24/7. And I couldn't just pour milk in my cereal bowl, put my feet up and watch Melrose Place and sleep for 10 hours. No, that's not an option. Way more exhausting than being an OBGYN resident. And lastly, And I'm glad, I'm glad that Andrea's here, that the support. I was alone. My parents are older. I didn't have family in town. Everybody else is at work. And I had a friend a good friend who had her second, a week before my son was born. And she would just come over and we would just nurse our babies together. And that got me through. He was a tough baby, but he became the best baby when she was around. And so I think what got me through personally was just having some support system, whether it's family or somebody. But I think we need each other. We can all support each other. And honestly, that was my biggest thing. So I'm sorry if I talk fast, but I want to give Maggie and Andrea some time to talk. So anyway, I will stop sharing. And here we go. Am I not sharing anymore?